All right, I'm going to do the incentive spirometer checkoff. Before I go into the room to do it on a patient, I'm going to check through the doctor's orders to make sure maybe they did order this, or a lot of times it's just a protocol through the hospital to make sure that every patient does have a spirometer, or maybe just post-surgery. So before I go in the room, I'll check all that. I'll get their estimated value, or I can bring a restrometer in and maybe measure some different values of the lungs to see what the value they should get. So on her, I already got all this figured out, so I'm gonna act like I'm going in the room. I'm Tyler. I'm a respiratory therapist here at the hospital. Today, the doctor ordered an incentive spirometer to help expand your lungs. So have you ever did one of these?
I have not.
Okay, and some patients, as you walk in, they'll actually, quite a few have done them, but just make sure to walk them through the steps again. So, an incentive spirometer, what it does is it expands your lungs to keep them working normally like they would have, so there's no buildup of fluids or, prevent infections and all that to keep them working. So what we're going to do here, hold on, let me wash my hands. Make sure you wash your hands. So what I'll have you do here is I kind of already got a value and I set it for you. We want to try to get around this as your estimated value of 2,900 milliliters on here, kind of see. But what we do on this is you're going to take it and you're going to kind of just do a normal exhalation, and then when you're ready, you're going to put your lips around that and suck in slowly, and kind of you'll see it'll level out, and you're going to get the biggest inhalation you can. All right, I'll have you do that there. Oh, before, make sure to check out their vital signs, so heart rate, the SpO2, check their breath sounds, and maybe blood pressure if it's running there, and all respiration rate. After you do that, then she can do that. So I'll have you, again, just put your lips around it, and inhale for me, or exhale normally, and then inhale as big as you can. And see, you are leveling it there. That looks good. All right, and then I want you just to take a little rest. During this, you want them to have a 3 to 5 second rest kind of between inhalation, so they're not hyperventilating, which can lead to kind of some other conditions. So after that, I'm going to have you keep doing that, and I'm going to have you repeat this about 6 to 8 breaths per hour on this, or inhalations. And on this, I want to record, what she gets up to, and I'll check on her periodically to make sure she's keeping up on it, and then assess that she's doing it right, every so often, so she's not continuing to do it wrong, and make sure this is working. After that, I can reassess all her vital signs to make sure, there was no hyperventilation causing her vital signs to go off or to change drastically. If there is, you may want to make sure she's not hyperventilating when she does it next time, and kind of let the nurse know. So after this, I'm going to make sure I keep it, where she can reach, because she's going to do it. And if she can't move to it, then she probably won't do it. So make sure it's within reach, probably on the bedside table that's usually next to him. Then I'll say, or I'll just kind of explain, make sure you do that again, reiterate what I said, make sure I have the call light, the safeties, and her call light is in reach, her bed's in the lowest position locked, all the safety requirements. Make sure, if there's any trash that I did use or anything I threw away, and then I'll wash my hands and exit the room, and also let her know when you'll come in again to maybe make sure she's doing and all that. And that's my checkoff.